Here's Dr. Gil Lederman, New York's only Harvard-trained, triple-board-certified radiation cancer doctor. If chemosurgery or radiation isn't working or isn't tolerated, when cancer and its pain and symptoms aren't getting better, seek a fresh second opinion at Radiosurgery New York's Urgent Cancer Consultants for innovative, custom-tailored cancer treatment. See our experts within one business day because we know your time and your life are precious. Our goal is proper diagnosis and effective, non-invasive outpatient treatment. Decades of leadership, first in New York with brain radiosurgery, first in America with body radiosurgery for cancers of the brain, body, and prostate, all custom-tailored for you. Call 212-CHOICES, 212-CHOICES for a prompt appointment and free booklet DVD. Super convenient, 38th and Broadway, with most insurances, Medicare, Medicaid accepted. You're next at Radiosurgery New York. Just call 212-CHOICES, 212-CHOICES.
Welcome, everybody. It's the Radiosurgery Show with Dr. Gil Lederman, MD, New York's only Harvard-trained, triple-board-certified radiation oncologist who brings you the latest cancer treatment news, interviewing world-renowned cancer experts, delving into special cases, and, of course, answering your questions. I'm Rob Redstone, broadcasting from the WOR studios in the heart of New York City. And now, please welcome Dr. Lederman.
Hi, good morning. Hope you're well, enjoying the beautiful day. My name is Dr. Gil Lederman. We're here for the Radiosurgery Hour, which is in our effort to bring you the news behind the news to help you understand about healthcare and cancer treatment. We work at Radiosurgery New York, which is a private cancer treatment center in Manhattan, 38th and Broadway. Private means it's not sponsored by the drug companies or the surgeons or the big boys. We work for you. And as you'll see, that makes a heck of a lot of difference when there's not secret hands telling people what kind of treatment you should have. So, what does that mean? Well, let's just take a look at this scandal at the VA. This week has been filled with news reports about the scandals at the VA. There was a Dr. Hollenbeck who's a whistleblower. She worked at the VA. She saw things she didn't like. There was a study that showed that the Jackson Hospital in Florida didn't have enough doctors. The nurses were handling too many complex cases that the doctors should be handling. There were multiple complaints from the patients at the VA. She, the doctor, said, quote, "It was unethical to put us in that position." Speaking of the overstressed doctors in the VA, "Your heart gets broken," she said. So at the heart in Phoenix at the VA was falsified data, and possibly at many other VA hospitals. There were a shortage of doctors to handle patients swelled by aging veterans from the Vietnam War and younger ones from Iraq and Afghanistan. So what exactly was happening? Well, our friends at the VA, bureaucrats, government employees, and others devised schemes. And this is an article, by the way, that was this week in the New York Times, if you have any doubt about it, May 30th, 2014. You can look it up yourself if you have any doubts. Schemes were designed to disguise wait times by a variety of approaches. In Phoenix, administrators were overwhelmed by patients, and so veterans were not logged into the waiting list, making it look like there weren't delays. If you're not on the waiting list, then there's no delays. Government strategy. You wonder why people don't like government in health care. Well, there's some of us who worry about that. Another strategy, and this is an article written by Richard Opel and Amy Goodnow in the New York Times this week. Another strategy, according to documents, was for the Veterans Hospital's employees to record the first date a doctor was available as the desired date for the patient, even if they wanted an earlier date. They said, yes, it's gaming the system. In Jackson, Dr. Hollenbach reported that the VA created ghost clinics in which veterans were assigned a non-existent clinic and doctor to make it appear they were receiving timely care. And in Albuquerque, an employee at the Veterans Hospital said doctors were shocked when they received a memo a few months ago saying that 20% of physician performance pay would be doled out only to doctors who found a way to limit patient follow-up visits to an average of 2 a year, a tactic to reduce waiting times by persuading veterans to see the doctor less. And quote, unquote, clinic staffs were instructed to enter false information into the veterans' charts because it would improve the data about clinic availability. So what do you think about your government in healthcare now? Pretty worrisome, right? And that's why we talk about a private doctor in a private cancer treatment like Radiosurgery New York. You want to be seen. We guarantee we're going to see you within 1 business day. Stop the end. You want to come in tomorrow? We will see you. We'll work harder. We will see you. Without this kind of stuff in government, falsehoods and corruption and scandal has no place. And similarly, this week in the Wall Street Journal, May 28th, front page story, insurers are pushing, the headline is, insurers push to rein in spending on cancer care. And what's happening now, one of the largest insurers, WellPoint, is going to offer oncologists, this is an article written by Anna Weil Matthews, insurers, WellPoint, are going to offer cancer doctors $350 per month patient to the doctor if the doctor puts the patient on the insurance company's preferred treatment. Now, you go to your doctor so your insurance company can tell them how to treat you? Or do you want your own private doctor who treats you the best possible way? Seems a little bit strange. Now, in the article in the Wall Street Journal, they said these efforts have the potential to transform the way doctors practice medicine, and they can create pushback if they are seen as heavy-handed. The head of Cleveland Clinic's Cancer Center said they're going to participate in the WellPoint program where it makes sense, and the extra $350 payment is not something we'd ignore. So here's Cleveland Clinic, a big cancer center, a big hospital. And there's more than Cleveland Clinic. There's some just around the corner from you who are going to participate. And how will you know who's getting a kickback to dictate how you should be treated? Is it a treatment that you choose with your patient and doctor relationship, or is it something the insurance company is dictating? The head of Cleveland Clinic, went on to say, we generally don't like to practice by insurance company. We practice by the patient. Then why is he taking the money? Why is he taking the money? It doesn't make sense. And here's one more point in the article. According to an analysis, the average reimbursement for cancer treatment is 189% higher in hospital outpatient facilities than in doctors' private offices. So in a doctor's private office, like ours, you can have a relationship with a doctor. You don't have secret kickbacks. You don't have scandals about not being able to see the doctor. And the cost is less. And here's documentation. The cost is less. So it's big scandals, very big scandals, and big issues about how medicine is being practiced. Are you getting the care that you want and that your doctor wants to give you? Or are bureaucrats and insurance companies dictating how you should be treated? It's something to think about. And it's something to think about the benefits of seeing a doctor in a private cancer center like Radiosurgery New York, where there are no kickbacks. You have a private doctor, not a student, not a nurse. You have the doctor and a relationship with the doctor to get the best possible care. So good morning. My name is Dr. Lederman. We're from Radiosurgery New York, and we're talking about cancer and treatment and what you need to know to have a healthier, better life. I wanted to talk about a patient I saw just 2 days ago. It was a 59-year-old man who presented with back pain. And often people have back pain, and you go in and they say, oh, you have sciatica, or you have this, or you have that. Well, this man, thank God, saw his private doctor, and his private doctor ordered his patient to have a scan, and he found extensive adenopathy, large, bulky lymph nodes throughout the back of the abdomen, called the retroperitoneum. And his pain, which was so severe, was requiring that he gets narcotics to relieve it, was being caused by this cancer. So he came in this week. He's 59 years old, divorced with one child, and we saw the scans. We got all the documents. And what are we doing? Well, we're going to put a little needle in that cancer. We're going to find out exactly the type of cancer it is. We're not going to cut any corners. And then we're going to offer him proper treatment. And there's a variety of treatments. With radiosurgery, this kind of mass, which is probably lymphoma, will probably melt away, and probably his cancer pain will go quickly away. So for this man, has a great doctor, worked him up. He didn't say, oh, you have sciatica. He got the test to prove the cause of the back pain. We're getting the biopsy to prove what's in those lymph nodes. And then he's going to have proper treatment to make the cancer go away and to relieve his pain and suffering. So treatment should make sense. There should be logic behind it. And here you can see there's a logic. Work it up, find out what it is, treat it, make it go away. Even for cancer. Yes, even for cancer. And speaking of that, I'd like to speak about a patient who's 86, black woman from the Caribbean, French-speaking, who has metastatic breast cancer. She's been seeing me for a year and a half. Over that period of time, we've treated about 5 different sites in the breast, lymph node, bone, about 5 sites with radiosurgery. What is radiosurgery? It's focused beam treatment that allows us to attack the cancer without hurting the healthy tissues. So usually there's just 5 treatments. Each treatment's about 15 minutes. You come in to our office, which is at 38th and Broadway. You get a treatment, turn around, go home or go to work or go to lunch, whatever you want. Well, she's had these treatments. She finished the treatments last year. How do we know treatments are working? Well, we like to get a scan of the patient. And in this case, she got a PET scan on May 21st. And the PET scan is totally normal. So all the cancer that we treated last year went away. Actually, she had a PET scan 3 months ago, which was negative also. So now she's had 2 PET scans. So sometimes doctors say, it's a systemic disease. You need treatment all over your body. Well, that'd be great if it worked. But very commonly, chemotherapy for metastatic stage 4 cancer doesn't work that well. Whereas radiosurgery, for example, in this case, stage 4 breast cancer, we treated the spots. They went away. They haven't come back. Thank God. She's doing great, asymptomatic, living her life, happy, and her family's happy. Her sons are so happy. They're physicians. They never knew about radiosurgery until they heard about us on the radio. They came, and now they're biggest supporters because they've seen in their own eyes with their mother how the treatment has worked without side effects in just a few treatments. And we have documented proof the treatment is working. We're going to hear from our sponsor, a few new voices, and then we'll be back. If you have questions, please call us. We are live. I'm live at the WOR studio. Our number is 1-800-321-0710. 1-800-321-0710. If you have a private question about cancer treatments or other things, you can always call us at 212-CHOICES, which is our office number, 212-CHOICES, 212-246-4237.
For cancer treatment, most prefer effective, non-invasive, well-tolerated outpatient therapy. With Dr. Lederman, the radiosurgery pioneer, that's our goal, too. He's first in America, first in New York, first for you With Body Radiosurgery, we hit your cancer with